now the problem is because now we know that we have not only the acute inflammation, we have the chronic inflammation. The important is how to detect this chronic inflammation. Yeah, because we cannot open the head of every patient. So that we try to find different biomarkers. And we have imaging biomarkers and we have fluid biomarkers. The imaging biomarkers are, for example, we have now, we are doing 3 Tesla MRI. And with this 3 Tesla MRI and with a special sequence that the name is SWI, we can detect some lesions that the name are paramagnetic ring lesions. And these paramagnetic ring lesions, they are the sign of the chronic active inflammation. And when a patient has, at the beginning of the disease or in the middle of the disease, some of these PRL lesions, we know that the prognostic is very bad. On the other side, we have another kind of lesions that we can see in the MRI, that the name is the slowly expanding lesions. For these lesions, we need to have at least 2 MRIs to compare, and they are lesions that they are the direct sign of the chronic inflammation. So that when we look at 2 MRIs and we see that one lesion is expanding in a concentric way, we see that the patient is progressing. So that we can look at the future with a special software how these lesions are slowly expanding. And we can see when this patient has a lot of these slowly expanding lesions that the name is cells, we see that this patient is progressing more and they will have a bad prognosis. So that they will, with these 2 things, PRLs and cells lesions, we can look at this progression with the MRI. And the other side, we are looking at these fluid biomarkers like neurofilaments and GFAP, GFAP. And we try with these two biomarkers, we try to combine to see which patients are progressing in a bad way. So that we know when the patients, they have a GFAP very high, but the neurofilaments are very low, we know that this patient is progressing and this patient has no acute inflammation. So that they are biomarkers that we can take from the blood. They will be very easy, and in 2 or 3 years, they will be new software, new machines that they can do in a very easy way and very cheap way, so that the most of the hospital we will use these kind of biomarkers.